I'm delighted to say, though, we've got David Loughton, Chief Executive of Royal Wolverhampton and Walsall Healthcare. You can say hi to each other. That's fine.
Morning, Anne.
Hi, David. Nice to see you.
Yeah, good to see you. You're okay?
Good, thank you.
Isn't this
Very
lovely?
inspirational,
We don't always get the opportunity to see two chief executives kind of shaking their virtual hands. That's lovely. And I'm delighted to say that David is also one of the good people who lead NHS organisations. So we've got another fantastic thing. But Anne, thank you very much indeed. We will see you soon. By the way, I am up in St Helens and Knowsley at 7th and 8th of December. We're running some leadership training up there. Go and see David Brewster if you'd like to be enrolled on that. That's going to be a fabulous 2 days. David, it is an absolute joy and pleasure to have you with us this morning. You are a huge supporter of the Institute. And of course, you were awarded a companionship earlier this year as well, which was richly deserved. You are going to be speaking about the integrated care activity in the Black Country. This is something that is of huge interest to everybody who's on the conference today, and of course to our members who may be watching this via catch-up. So I'm going to hand straight over to you, if I may. Thank you very much indeed.
Okay, thank you, John. Probably worth me just sort of telling people something about myself, actually. I used to be the youngest chief exec in the NHS when I started as a chief exec in 1991. I'm now probably the oldest, but there you go, that's life. And I have thoroughly enjoyed the last 31 years as a chief executive. There's been some trying times, as one would expect. In terms of talking about collaboration, I mean, we've had pretty near 2 decades of organisations competing with one another in various ways, sometimes very openly and sometimes not. And I think what has happened here in the Black Country, and for those that don't know, the Black Country is just outside of the sort of circle of Birmingham. It consists of Walsall, Wolverhampton, Dudley and Sandwell. And there are 4 acute hospitals covering that patch. And I can go back to 2005 when there was the first review of Black Country services, and nothing has happened since 2005. And we've started to move on now. And sorry, I need to explain actually, Wolverhampton is the tertiary centre for the Black Country and has been since time began. So there has been a lot of working together with the other 3 acute hospitals and sharing services for, you know, a generation at least. I think the difference has been the coming together of Royal Wolverhampton NHS Trust and Walsall Healthcare Trust. Both trusts provide acute services, and both trusts provide community services, and that is actually quite important to state, actually. And in the case of Wolverhampton, we also manage quite a number of GP practices. So the 2 organisations are located 4 miles apart, and it is divided by the M6 motorway. And as I always say, when I started in the Black Country, because I was new to the Black Country, I came to realise very quickly, in terms of our populations, there was more than the M6 that divided them. I think when there were villages back in the 14th century, they were probably fighting with one another. So all of the boroughs and the city of Wolverhampton have got very strong identities to place. And that is really important as you talk about integrating services. You've really got to understand that people know. I haven't ever heard anybody say, I live in the Black Country. Everybody will say, I live in Wolverhampton, I live in Walsall. They don't say the Black Country. So in terms of bringing the organisations together, we serve very similar populations, and really unwanted variation and reducing health inequalities is the top priority for what we are actually doing. So there's significant opportunities there. The we have a shared leadership team, shared governance arrangements. And I think it's worth saying, actually, because I've got CQC in at present at Walsall, doing well led. And this is really work in progress, because we started with the approved collaboration in January 2021, and I'm still working through having shared director posts. So I think we've really got to understand that this is a journey, and I've merged with other NHS organisations in the past, most notably Stafford, and when I was chief exec in Coventry with Rugby. You know, this is a journey, and you don't get to the end point straight away by any stretch of the imagination. It probably takes 2 years, and there is a period where you start going backwards until you come up the curve on the other side and start making real improvements to patients' experience, and most importantly, the staff experience. The principles of cooperation, without any doubt, and it follows on from what Anne said, you know, your focus has got to be doing the right things for patients. And as long as you keep that at the forefront of your mind, I think you can more or less do anything. So we have got a lot of things going on to improve services. And I think it's worth saying, in any two NHS organisations, there are always really some good things in one organisation and good things in another. And you can actually cross-fertilise those. And certainly in the case of Walsall, Walsall has got the best performance in the West Midlands for ambulance turnarounds. It's always number one, and it performs really, really well. And some of that is because of something called Walsall Together, and that is working with the local authority, social services, and real integration. So I'm being very clear, and I made a mistake in the past, actually, when I was in Coventry and I merged with Rugby NHS Trust. I didn't actually put a medical director or a nurse director on site in Rugby. 18 months later, I had to do that. So I've been very, very clear from the outset that there would be significant executive director presence on both sites. So to take an example, you know, I made the mistake with Rugby, and 18 months later, I had to put a medical director and a nurse director on site, because you cannot expect staff who have got issues, you know, that they need to discuss with the medical director to get in the car and drive 16 miles down the M6. So we're very, very clear. And the nurse director in both organisations, the contact with the MNC is directly with the nurse director, not the group nurse director. And with the medical director, the GMC contact is directly with the medical director in Wolverhampton and Walsall, not through the group medical director. You've got to be really clear about those sorts of things. The other thing that we have done is combine a number of things. We've got one payroll department. In fact, I provide payroll services for 70,000 staff in the NHS. I've got a big payroll department. Procurement, we are in a partnership with a number of NHS organisations. But the key thing that I would actually say about this is getting real employer benefit to the staff that we serve. Because as I always say, you know, I don't deliver healthcare at all. All I can do is improve the working environment as best I can for the staff. And, you know, we have established a number of processes to plan and deliver changes for both staff and patients across both of our trusts. The benefits, I suppose, have come from various collaborations, but most importantly, as you can see from that slide, we've got a number of group roles. I also, and this is no real criticism, but it probably is, Walsall went into special financial measures 5 years ago. And in a period of 5 years, there were 5 nurse directors, because organisations that are in special financial measures do things that, you know, when you look back, are not particularly clever. People left and those posts were not replaced. So, you know, I've had to, there was no head of safeguarding, no fire officer, training and development, the person responsible left and wasn't replaced. So we weren't giving managers the tools to do the job. So I've got quite a long list of posts that were vacant at the time I started. So I had to draft in people from Wolverhampton, and that hasn't gone down particularly well with some people. With a lot of people it has gone down well, but with some it hasn't, because quite clearly it was seen as a takeover from Wolverhampton. However, there's been huge benefit to both organisations as we have gone through that process. And the key thing, I suppose, has been in terms of staffing. I haven't employed agency nurses in Wolverhampton since 2005. And in 2005, I stopped using agency nurses because I couldn't control the quality. And at that time, we were the 3rd worst for infection prevention in the NHS. Within 2 years, I went on to be the best in the NHS at the longest period of time with patients with MRSA bacteremias, a record we still hold to this day. And it was stopping using agency nurses. And when I started in Walsall, my stated aim was to stop using agency nurses by the end of October this year. I missed that, but I never really expected to achieve it. I was being overly optimistic, but we've recruited over 300 nurses into Walsall in that period, and it has absolutely transformed things. Likewise, I've got over 300 clinical fellows on our own training programme, and I can recruit consultants from our own training programme and GPs. And we've now started to really go at pace with clinical fellows in Walsall. And I think realistically, I'm probably a year away from not employing any locum doctors. And that has a massive impact, because, you know, in Walsall, if you'd got band 5 nurses where the agency was charging £158 an hour, the nurses were being paid about £85–90 an hour, working alongside nurses that were getting paid £21 an hour. That doesn't go down particularly well, does it? So it's not only the quality, it's also the cost of that. The other roles that I suppose are worth mentioning, great benefit out of having a group director of assurance, and that is across both organisations, and we are harmonising an awful lot of the governance processes, likewise with the company secretary, and getting some real sort of benefit. There were other things, isn't there, that a bit crazy really. Walsall used to get its catering service from South Wales, and I'd got a £6 million kitchen in Wolverhampton. So guess what? Where they get the catering from now, and you know, there's an awful lot to answer for in terms of EU procurement at how you get into that sort of situation. And on that, in terms of trying to help with the cost of living crisis, we provide a hot meal for staff for £1.50. I couldn't do that if I wasn't absolutely in control of the catering process, and that is really important. It's probably worth saying, as I pick up that point, in many ways, on the 7th of March 2020, when I was called in, and we had the first COVID death on the 8th of March, which was the 4th in the country. At that time, I don't think our staff were not particularly frightened. They were professional, they got on and did the job, but there wasn't the fear that I now see. And I think morale in the NHS is at its lowest point that I have ever seen in my career. And that is not driven by necessarily things that I or my team are doing. People are really frightened because of the cost of living crisis, energy, etc., pay rates, and that fear is real. And a lot of people talk about the low paid and fear. Believe me, I know some people who are paid, 30, 40,000, 50,000 pounds a year, who are really worried because of interest rates, because and we've got a generation now that have been used to low interest rates, and they've taken out mortgages and they're really, really worried. And people do not leave their financial problems at home when they come to work. So that is really important to bear in mind where we're at the present time. We have a committee in common, if I'm being quite honest about it. It works reasonably well. I think we've got further to go. One thing that we have done, because I had a number of non-executives in Wolverhampton that were coming to the end of their second term, so and chances of agreeing a third term were remote. So we've done quite a swap actually of non-executives from Wolverhampton coming into Walsall and non-execs in Walsall going into Wolverhampton. And I've got to say that it is really important when you're doing this sort of thing that the non-execs, get on with one another, work together well. And that is really important, because the question I always get, do I have plans to merge the organisations? Well, merger is not a top priority, because I think it would be, at this point in time, a distraction. I would get the support of two of the Walsall MPs, but probably not the support of the third one. And I think all three in Wolverhampton would be okay. But, going through a public consultation for a merger of trusts, I've been here before, I've done it so many times, it is really distracting, because you get into the debate of what services are going to be moved from Wolverhampton to Walsall and vice versa. And, it's distracting. So, as I've already said, you can see on that slide, we've really done well with international recruitment and also recruitment in the UK. It's worth saying as well, I think we started the international recruitment many years ago, and the people that run it for me, they are fabulous. I've got someone on call 24 hours a day, 7 days a week for our international nurses and international clinical fellows. They can phone at 3 o'clock on a Sunday afternoon when they've got a problem with their bank account, and they will get help to do it. You've got to go the extra 1,000 miles to provide security and support to these people that are coming into this country. We also, pick them up at the airport, take them to the supermarket, take them to the place of religion, and take them to the accommodation that we have found, because I've got an approved list of landlords in both Walsall and Wolverhampton. And that is really important, because, we all talk about retention of our workforce. It's harder and more difficult in terms of retention of some of our overseas staff. And that is really important. We put in a joint funding bid for Community Diagnostic Hub. That was successful. And Cannock Hospital, probably not many of you have heard of Cannock Hospital, have you? I bet you've all heard of Stafford Hospital, but no one knew that Mid Staffordshire Foundation Trust consisted of two hospitals. It consisted of Stafford, which everybody knows, and Cannock Hospital. And as part of the disaggregation of Mid Staffs between ourselves and Stoke, I got Cannock Hospital. It is a fabulous, fabulous elective centre. I've spent £45 million of capital on it, now spending another 30 million. and it's a joint elective centre for Walsall and Wolverhampton, 10 operating theatres, 2 MRI scanners, 3 CTs, ophthalmology unit, renal unit. It's a fabulous cold centre because it's got no A&E department and it's got no emergency medicine. So it's really good. The other thing that I've done in terms of doctors in training, my senior team from Wolverhampton came into Walsall, and they have really gone at pace in terms of satisfaction of doctors in training at Walsall. Because many, many years ago, I set about giving medical students from Birmingham Medical School the best experience and satisfaction I could, because the strategy is ever so simple. Happy medical students want to come back as doctors in training, and happy doctors in training want to come back as consultants. Job done. So that is really important. Also, final thing on there, infection prevention, real standardisation across both organisations. I've minimised the service transfers. I had to transfer emergency urology from Walsall to Wolverhampton because it wasn't viable, but I transferred a lot of day case urology back to Wolverhampton. Dermatology, Walsall has got a fabulous dermatology service and really top quality research. So that is now a service led from Walsall for Wolverhampton. R&D collaboration, Wolverhampton hosts NIHR for the West Midlands. So we've got a real collaboration going across research and moving in. I think the one thing that I would say with all of this, you know, we've got 17,000 employees across both organisations, and there are certain things that really improve when you're doing it at real scale. We've got a joint strategy for quality improvement, again working on both organisations, because as I've already said, Walsall's ambulance turnaround times, which West Midlands Ambulance wax lyrical about how good Walsall is. I wish Wolverhampton was that good, but it's not. So that is really good. And as I've already said, joint working with renal ophthalmology. This is all work in progress, because the one thing that we're doing, the medical director in Wolverhampton is now the medical director lead for the Black Country collaboration, which involves all 4 acute trusts, and we're bringing consultants together from all 4 organisations to work out how we can change services across the whole of the Black Country. I'm conscious of time, so I better move on. Well, when I arrived in Walsall, my first fallout in, I think it was my second week, was with the PFI contractor, because Walsall had got a PFI, which I thought they'd built a new hospital. They hadn't. It was a third of a new hospital, and the retained estate was appalling. And I brought my contractor in from Wolverhampton, who upgraded wards at a third of the price that the PFI contractor wanted. So I had a few arguments there, and we are really getting on and upgrading wards. I cannot overemphasize how much of an impact that's had, particularly on nursing staff in Walsall, who have been working in environments that were not fit for purpose. So that is really good. And the other thing about bringing your own building contractor in, 90% of the building contractor's staff live in Wolverhampton or Walsall. So we are providing a lot of local employment. I've already said about nurses, consultant posts, because there is opportunities for consultants in Walsall to work in the tertiary centre. Recruitment has been really, really good for consultants in Walsall, and that's it. Occupational health in Walsall is really good, and again, working now across into Wolverhampton. So they are, as I see it, some of the long-term desired benefits. We've got to really be able to demonstrate positive patient outcomes. And I'm pleased to say in both organisations, the patient satisfaction scores are going up, not by a massive amount, because as you all know, the NHS is under an awful lot of stress and strain at the present time, but at least it's not going down. And as you're all aware, satisfaction in the NHS is at its lowest point since time began, really, driven primarily by, if you keel over in the street, it can take 45 minutes for an emergency ambulance to get to you, and you can't get a face-to-face appointment with the GPs. They're the two things, in my opinion, that are really driving satisfaction in the NHS. I think we are, well, I shouldn't say this, should I? Because I've got my interview at 1:30 today with CQC and well led. So I've got my fingers crossed that will come out okay. Again, in terms of performance, that is improving in both organisations, and that's important. Financial performance, well, I'm not going to say a lot on that because I think the NHS is now in a very, very difficult financial place, and I don't think we're going to do too well. The one thing I will pick out from that, I think it has improved the reputation of both organisations by actually working together. And I've been quite surprised really at how particularly medical staff and senior nursing staff seem to seamlessly now work across both organisations, and that is really good. I think some of the other things that I would pick on is some of this has not been easy because, I've had to change a number of people. That doesn't necessarily go down well. But I think it is important that, we get stable teams. As I say, there were 5 nurse directors in Walsall in 5 years. That is not good. In Wolverhampton, my nurse director, who I love to bits, she was only with me for 16 years. And I think the results prove so stability is really important. And again, my finance director, he's been with me for many, many years. So having a good, stable team, I think is important if you're going to go through these sorts of change. So I'm probably out of time now with that, John. So I will stop there and happy to take any questions.
Well, that's great, David. Thank you so much. I was just about to come on and say you're out of time, David. So you absolutely, headed me off at the pass. Then thank you very much. Well, look here. I mean, isn't it interesting? Can you imagine the sort of the breadth of horizon that you need to have in your vision in order to kind of pull together this breadth of activity across such a large region and such a proud region as well. It's a fantastic place to live, but as a result of that, the population are demanding of the services that they look to access. And I think credit to you, David, for taking such a broad vision approach of what's required. Would anybody like to ask David any questions at all? We've probably got time for one. How about that? Do just pop your virtual hand up and then I'll indicate. Thank you.
Well, I've shocked everybody.
David, and I think they're all just in awe, really. I mean, it is.
Nah.
This is a 16,500 people organisation that you've kind of pushed together, basically. That is not insubstantial. If you look at somewhere like Guy's at St Thomas's, which I think is now the biggest in England, I think that's 26,000. So, these are huge organisations.
Yeah. I mean, it's probably worth me saying, my finance director is also the finance director acting in Dudley, and HR director is also in Dudley. I think you do need to take some care on sizes of organisations, actually, because the one thing that bothers me about this is visibility. I am really visible in Wolverhampton. I'm not as visible in Walsall, and believe me, I tell you, the porters, they're the best people in any NHS organisation for the reputation of the chief executive. because I walk down the corridor and I say, "Oh, hello, how are you?" And they go back to the porters. "Oh, I saw Dave. Dave's a good lad, you know." And all they actually did was say hello. And I'll tell you, a lot of
Well,
people.
look, Anne Mar would
A
say
lot-
exactly the same thing. She exactly the same themes. You know, Anne talks about visibility, repeating the vision, you know, making things simple for
Yeah.
people so that they
Well,
feel
also-
engaged with and loved and respected and so on.
Yeah. But the porters, they walk 14 miles a shift. They meet more people than any manager in the NHS. Yeah. So if they think you're okay, and then you talk to them and respect them, they'll go and pass that on to people.
Great stuff.
They're my PR department.
I've no doubt. Well, look, we've got to say a huge thank you to you. I'm so sorry, we are out of time. Bernard, I've got various questions here. Some really, David Brewster says, good luck this afternoon with your CQC meeting. Can't believe we even have to write that, but there we are, you know. It's been a joy. Thank you very much indeed, David. We look forward to seeing you again at another event, no doubt. Bye-bye.